Happy Friday, everybody. Dr. Amy Ostick here with Health and Healing Direct Primary Care.
Dr. Brian Ostick,
You got a fun t-shirt on.
1980 classic, the year I was born.
Yes.
Birthday's coming up, November 11th, Veterans Day, national holiday.
Yes.
Yeah. 40.
Awesome. Also a local ER doctor and director here in Van Nuys. What I wanted to talk with you all about today for a few minutes is something that's been swirling around in my sort of purview in terms of the literature I've been reading recently and things I've been thinking about, a lot of questions about from fielding from patients and from colleagues about, is herd immunity. And there's something going around that you may have seen in the general public, and also medical scientists and scientists alike have signed something called the Great Barrington Declaration. And what is that, Dr. Ostick?
What is that, Dr. Ostick?
The Great Barrington Declaration is something that a lot of people have signed. I think they're up to almost 10,000 or so, maybe more, signatures.
Oh, that's the thing where they're saying basically like, just let everybody get sick and we'll get herd immunity and then we'll be fine.
Well, to be fair, I mean, it was drafted by three very, very bright epidemiologists out of Stanford and Harvard. And they talk about kind of focused protection on the vulnerable patients in our population, people who are older, who are more at risk, underlying health conditions, focusing our resources in protecting those and letting the general population, the young and the healthy, sort of get the disease so that we can develop what's called herd immunity, which basically means enough of us have it that we kind of act as a stopgap, but from preventing spread of the disease. We have herd immunity for a lot of vaccine preventable diseases now, like measles, mumps, rubella, varicella, polio. Enough of us have received the vaccine in early childhood to develop, most of them, lifelong protection so that we don't see these illnesses anymore.
Right. And, all kidding aside, this was the model that Sweden used, right? Is that they were said, we're just going to stay open. The young and the healthy people will get it and be okay. We'll try to protect the older population and the people that are most vulnerable. And then, we'll kind of see where we go. And if enough people get COVID, then they most likely won't get it again and be spreaders anymore.
Right. And there's a lot of people that talk about, let's use Sweden as this model. And that, they had, when you look at Sweden compared to other countries, and they have a similar demographic to them, so Norway and Switzerland and
who did it differently than Sweden
did. They had an astronomically higher death rate among Sweden, among the vulnerable, among the older patient population, because of that approach that they took. They would really allow this disease to spread in the community in hopes of achieving herd immunity. What that did was it put those, it gave a higher chance of those at risk of getting this disease early on in the pandemic, when we really didn't have great treatments for this disease, when you were being hospitalized or whatnot. And a lot of people died.
And how does the United States compare with Sweden if we were going to do the Great Barrington Project?
Right, so there's a push now to model this sort of focused protection. And here's what I guess the takeaway point I would like to make here. And I just watched a great virtual grand rounds by Dr. Fauci at our alma mater, Thomas Jefferson University. And it was great to kind of get a good summary of where we are with the course of this disease, and certainly where we are with herd immunity and such. But the fact is, this disease not only has a very high morbidity and mortality rate in the older, sicker patients, but really with any underlying condition. So high blood pressure, diabetes, even if you're overweight, you are, you have a higher chance of getting very sick from this disease.
Yeah,
so
and that's what we see in the
not
emergency
just the
department,
over 80, but the 75 to 80 age group, the 60 to 75, the over 50 age group that maybe they have one or two underlying medical conditions. You are at much higher risk of getting very sick from this disease and dying from this disease. And over 40% of people in this country have one of those underlying medical conditions.
And that's the point that Dr. Fauci made at this grand rounds.
That's the point that he would make, is that a lot of people would have to die in order for us to take this approach of having sort of a focused protection for the vulnerable, and just letting this disease kind of run rampant. And
I mean, I would argue, I've never been there, but I would argue that Sweden's population is healthier than the United States population, right?
Right, and they saw, a case fatality rate that was much higher than the other countries that you would model their demographics after.
So we're an unhealthier population of people, and we're much larger in numbers than Sweden is too. So, yeah, I think that would be a disaster if we tried to do that here.
Absolutely, and I think that the only way to really achieve herd immunity right now, and the safest way, is through vaccines. And so our biggest challenge ahead of us, Dr. Ostick, is to get the message out that these vaccines, when they are ready and available, are safe and effective. They may not be effective, lifelong immunity. Family of coronaviruses, most respiratory viruses that we have vaccines for don't really confer lifelong immunity. I mean, look at the flu shot, we have to get one every year. Similar, we may need to get one every year, seasonally, but that would be a huge win. That's an unbelievable start, but enough people would have to get this vaccine. So our challenge is to educate people about the safety and efficacy of this vaccine, so that the people that really need it don't have skepticism and aren't scared and distrust in the medical system and don't get the vaccine.
You've got any insider scoop on when that's coming out, or which one is going to be the first one approved?
There are about 5 or 6 that are really good contenders right now in phase 3 clinical trials. Okay. And it sounds like, from what Dr. Fauci, who is obviously has his ears to the ground about it, says maybe in November, maybe December, we'll have a good candidate for that vaccine. Yeah. And then distribution-wise, we'll start probably early 2021 because they are mass producing this vaccine before they even know if it works, so that there's no delay. Once we know it works, we have it ready to go.
Have you taken any big stock positions in any of these pharmaceutical companies?
No. Not at all. I have no financial ties or disclosures. So I think that's something that I've been thinking about. There are a lot of physicians in my world that believe one way or the other about how to achieve herd immunity, that we should do it naturally. And really, at the end of the day, that would be rolling the dice with a lot of people's lives. And a lot of people that we love. I can name, in 2 seconds, I could name 10 people right now in my immediate circle that have one of these underlying medical conditions that will be at high risk of dying from COVID-19.
All right, so let's stay the course, wait for that vaccine.
That being said, we can maintain really safe and effective prevention and somewhat have a more or less open economy by social distancing, staying outside, wearing masks, washing your hands, staying in small cohorts. We can do things safely. Mm-hmm. We don't have to have massive shutdowns to maintain this, but we've got to be diligent.
Lastly, I am still in the under 40 age group just for a couple more weeks.
Okay.
So hopefully the vaccine comes out.
Yeah.
Before I turn 40.
Then your risk of mortality
probably pops up. Remember that Dr. Amy Ostick is here for you at Health and Healing Direct Primary Care. It's www.healthandhealingdpc.com. Phone number 818-600-2426. Call. You speak to Dr. Ostick. You speak to Anna Maria. They're the only 2 people that are here.
That's right. We're here for you. Thanks, guys. Have a great weekend.
Bye.